From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
So, how are you sleeping? We've been having trouble sleeping recently. Maybe the cause is the economy. The economic situation could be a contributing factor to health problems, including stress, sleeplessness, and headaches. Dr. Kim Goring is with the Howard University Sleep Center. She's actually the medical director of that sleep disorder center. She's an assistant professor of medicine at Howard University School of Medicine, and she's been good enough to join us to talk a little bit about sleeplessness. First of all, doctor, thank you for joining us.
Thank you, Dave, for having me.
Anxiety. I mean, it's difficult enough just sort of on a daily basis, but if you're looking at the 401k or if there have been layoffs at work and you're worried about your future and things like that, no question that this raises your stress level. Does that affect how well you sleep at night?
Yes, it certainly can. Some of us are more genetically prone to having difficulty falling asleep and staying asleep. It has to do with our biologic makeup. Maybe some of us are more inclined to worry and ruminate about our various problems. And we do know with the economy as it is, lots of us are having difficulty paying bills, etc. So yes, the anxiety results in increasing stress and difficulty sleeping.
Is this something that sometimes we're not even aware of as a problem until it has become a bigger problem? Maybe it's just, well, I was restless last night, or maybe it was the dinner I had, something like that. We'll ascribe causes to everything but the fact that I'm genuinely worried and it's affecting my life.
That is absolutely correct. Some of us are not in tune with the level of stress and anxiety that we are experiencing, and we tend to disregard sleep to some extent and often don't pay attention to really how much sleep we are getting.
And I think everybody understands sleep is important, but maybe we should talk a little bit about if I'm not getting enough sleep and if it's become a problem now, for not just a couple of nights, but it's stretched on now for a month or so, something like that. What are some of the very real threats caused by sleeplessness?
So the initial set of symptoms that you may recognize that you have include irritability, a bit of depression, anxiety, increasing anxiety as you're sleeping. Several of us experience daytime sleepiness, and the daytime sleepiness that's occurring because of the lack of sleep at night can result in mistakes on the job, and worse yet, if you're sleepy while driving, that definitely can lead to automobile accidents.
Yeah, there are a couple of good studies to show that they think a lot of the crashes that don't seem to have any other sort of obvious cause may be from sleepy drivers. Okay, if I recognize that there's a problem, what should I be doing to fix it?
Well, there are some do's and there are some don'ts. The don'ts: stay away from caffeinated beverages for at least 4 hours before your desired sleep time, and aim to be in bed for about 8 hours, that way allowing yourself the opportunity to have 8 hours total sleep time. So no caffeinated beverages, no vigorous exercise at least 2 to 3 hours before bed, because all of that alerts the body. In addition to which, avoid daytime naps. Some of the do's, things that in effect are good sleep habits, include make sure that your bedroom is cool, quiet, and dark. Avoid television or doing anything in the bedroom apart from sleeping and the intimate moment with your significant other.
No eating, for example.
No eating in bed, no watching TV, things like that end up alerting you more and making it more difficult to get to sleep and stay asleep.
Some terrific advice from Dr. Kim Goring, who's the medical director of the Howard University Sleep Center. We're right back. Hope you are too.